You're listening to Accounted For, the Canadian podcast that explores the intangibles of every career. I'm your host, Daniel Lee. Hello. Welcome everyone. Welcome back to Accounted For. Happy Wednesday. This podcast is part of OMD Ventures. It's an ecosystem created to be the place where people can be inspired to be unconventional. And if I'm trying to actually get you guys more involved in helping the podcast become better, and to do that, I actually want to start taking questions from you, the audience. And so you can give me your questions by reaching out on the contact page at omdventures.com. I think it's /contact, or you can just go to the website and click the tab, and there'll be instructions on how you can submit questions. And I hope to do like a AMA episode when I get enough questions, or I don't know, I haven't decided yet, but that's something definitely in the works. So help make it a reality by submitting your questions. And I also want to try doing something else that I'm currently experimenting with, is having deeper conversations with single listeners, and maybe even broadcasting that as a separate episode as well, and keeping that as like a part of an anonymous series as well. So there's more instructions on that on the contact page as well, so check it out. And yeah, I'd love to have more of you get involved with making the podcast a better listen for the others as well. And definitely subscribe to be in the loop for the newsletter, the essay, the podcast, everything, as well as a recap of the week. So that's something I exclusively write in the newsletter now. And so definitely subscribe to that at the stakeholders tab, or I think it's the support tab now in the website. That's the fun thing about creating your own website and your own platform. You're constantly making it change and grow every day. So if you are a long-time listener, you're definitely seeing the website change constantly. And so bear with me on that. All right, so enough about me. Today's guest is Graeme Moffat, the Chief Scientist and VP of Regulatory Affairs at Interaxon. Interaxon is a neurotech company based out of Toronto, and they are the creators of the Muse headband, so that's MUSE headband, where it uses technology and neuroscience to help you meditate effectively. And they're one of the world's leading companies that are actually making this happen. So it's actually just a literal headband device that you would put on your head, a wearable. And so Graeme earned his PhD, so he's Dr. Moffat, in neuroscience at the Universite Aix-Marseille. I hope I said it right. It's a university out in France. But instead of pursuing the typical academic career for someone who gets a PhD, he had his sights set on joining the private sector, all really formed out in his early years while he was getting his neuroscience education in McMaster. But whilst really having his sights set on the private sector, he was bit by the startup bug whilst building the largest neuroscience publication platform in Switzerland. And that led him to become the chief scientist at Meta, a neurotech company that got acquired by the Chan-Zuckerburg Foundation, and later to become the first chief scientist at Interaxon. In our chat, we cover Graeme's fascinating global journey as a neuroscientist. As you've heard, he's a guy raised in Ontario who goes to get his PhD in France, joins a startup in Switzerland, so he has a very global career, and we definitely talk about that. And we also talk about the academic world that he has had a large exposure into, and he constantly is involved in at the university lectures, as well as helping other PhDs think differently about their future career as neuroscientists as well. And we'll talk about the childhood that started his fascination with the human brain, and just so much more, like even ways of how people who don't have a neuroscience education can get involved in the field with modern day technology, as well as just the various resources that are out there. I should also add that I selfishly wanted to learn more about neuroscience and meditation because that's something I'm just so fascinated by. And so we also do geek out about all that kind of stuff in the episode as well. And Graeme's just so much more technically advanced and just smarter in just many ways in terms of all this stuff than I am. So I am constantly asking him to dumb it down so that I can follow along. And so if you're anything like me and just basic primary, maybe even like primitive understanding of neuroscience, you might appreciate it. But If you're just more advanced than I am, you might get a little frustrated, so please forgive me on that. But without further ado, here's my conversation with Graeme. Hey everyone, welcome back to Accounted For. Today on the podcast, we have Graeme Moffat. Hey Graeme, thanks for coming on the podcast.
My pleasure. So it's actually pronounced Moffat.
Oh, I'm sorry.
No, that's all right. No, I
Moffat.
mean, it's a tough one to get.
Okay.
Yeah, it's Scottish.
Scottish, okay. Yeah. Are your parents both Scottish?
My grandfather's from Scotland.
Oh, okay. Gotcha.
Yeah.
All right. Good to know. Well, Graeme here is the Chief Scientist and VP Regulatory Affairs at Interaxon. And so, Graeme, for the audience who are not familiar with Interaxon, can you give them a background of what the company does?
Yeah, so Interaxon is, I think, the world leader in consumer neurotechnology. We make wearable EEG systems and biophysical or biosignal systems that can be used for a variety of things. So the big application that most people buy our signature product Muse for is neurofeedback assisted learning of meditation. So there's a big demand now to learn how to meditate and be better at meditating. And, a lot of people struggle initially when they try to learn how to meditate, and they find it difficult to stick with because they don't have any feedback, because when you're inside your own head, looking at your own thoughts and trying to comprehend them and focus on them, there's no way really of measuring that except with neurotechnology. So even meditation teachers have to look at very subtle cues and ask questions of you to try to understand whether or not you're getting it. And we use neurotechnology and specifically electroencephalography with some signal processing and machine learning to create an experience that runs on mobile devices connected to wearable EEG systems and now also biosignal systems like heartbeat feedback and things like that, and respiratory feedback, to help people learn how to sit and how to breathe and how to observe their thoughts and how to hold focus. Mm-hmm. And that's what Muse does. And so Muse is a 4-channel electroencephalography system. You can check out our website, choosemuse.com, and it gives a pretty good summary. And there are a lot of research papers up there associated with all of the different applications that are accessible with the technology, because it's we built sort of an open platform and allowed people to create research tools of their own. And some people even created apps of their own. And that has allowed a lot of neuroscientists using open tools like Python and even educational tools to use Muse as a field research tool or a low-cost research accessory or an in-class educational tool to teach about biosignals and brain signals and things like that.
Wow. And so then if someone were to go out and actually buy the Muse headband and they just put it on, it'll just kind of guide them through everything? Is that how it works?
That's all of the kind of best wearable technologies, or the best mobile technologies are things that guide you into the experience in an intuitive way and help you understand how to use them. And EEG is tricky because you have to get good signal quality in order for it to be useful. Otherwise, you're recording just noise. So you have to teach people how to put on a wearable EEG system and get good signal quality. And that's a user experience and a user research challenge that we solved a few years ago when we first started. We didn't solve it initially. We continued to improve, and I think we've gotten better and better. But that's a big challenge. And so the experience has to be engaging and educational and give something back to the user pretty quickly. And
EEG is like this. I'm just very, just assume that I know nothing about anything neuro. So,
right, yeah. So EEG is brainwaves. It's the kind of thing
Gotcha.
that if you have epilepsy or if you have sleep disorder, you go into the hospital or to a sleep clinic and they put these leads on your head with wires connected to them, and now they're wireless. Often you can make wireless systems that have little battery packs attached to them. Sometimes they're encased in like a swim cap style system. And sometimes they're in configurations like ours, which are designed for consumers that are very sparse, have only a few channels that you can still get useful information out of. So in brain imaging, there's always a trade-off between how complex and big the machine is and how long the setup time is for measurement, and how much data you need, or how many data points or how many points of recording you need in order to see something useful. You can always see more with more channels, and you can see more with more expensive equipment. So the question is really do you have enough resolution with what you're doing with what you're using in order to do what you want? So electroencephalography is just brainwaves, and there are a number of different ways of really approaching that. But, fundamentally, it's a reflection of populations of neurons communicating with one another in the brain. So you see transient events when you either perceive something in the environment, or when you engage in a cognitive action, or even when you engage in a motor action. There's a motor part of the sensory motor part of the brain that initiates motion and plans motion, and you can see these things, but you often have to average over multiple repeated efforts of whatever task it is, and then look at an averaged signal to see these transient ones. And then there's ongoing EEG, which is oscillations and non-periodic activity that is sort of in the background. And for a long time, we didn't quite know, and we still don't have a complete picture of what all of these things mean. But the oscillations seem to relate to long distance communication within the brain. So between different networks of cognitive and brain systems.
So then, right now, if I put on the Muse headband, it's detecting, if I go through meditation, it'll go through my brainwaves and see if there is change, then that's the result I'll be seeing, to see that is it, am I finding a calmer state? Is my mind calmer? Like, it's going through that kind of imaging from.
So not only is it's doing a direct feedback where we calibrate for some amount of time in the setup, and then we try to help people drive toward a state of relaxed focus.
Okay.
And there are characteristic components that are common to almost everyone when they're in that state. And then there are unique parts that are unique to each individual. People's brains change with age. They change with how much sleep they've had. So these characteristics change from day to day. They're not some are highly stable and some are not, even within an individual. So you have to, and between individuals, they can be different. So you have to calibrate to an individual, and you use machine learning and data science to do that. So you build this into your data pipeline, and then when you get the feedback you get is you're in a virtual auditory environment. So you pop your headphones on, and you're in a rainforest or on a beach, and you're hearing sounds of like the wind and the rain, and that sound gets noisier, it gets stormier as your attention slips, and that's a cue to bring your attention back to, say, your breathing, or to focus on a specific thought and try to hold it.
Oh, so it adjusts as I
go
through it.
It's real-time adaptive feedback.
Wow.
To teach you how to recognize your thoughts.
And so then for you, what is your meditation practice like?
Mine is varied, I would say. Sometimes it's like getting on a bike and riding for 100 kilometers and zoning out to do that. Sometimes it's using Muse, and sometimes it's just sitting and practicing a sort of a classic kind of Vipassana meditation. So an open monitoring or a mindfulness meditation.
Yeah, I just had my own mindfulness session just before coming here.
Oh, cool.
But yeah, I've never really had a way of using any kind of metrics to measure whether I'm being effective or not. Like, is there something you use outside of Muse to tell?
That's a philosophical debate within the meditation community, I would say. So we built in some measures because people like scores, and the scores are there really to give them. You can look back on your session and you can see where your mind was way off, wandering, and you can see where it was focused. And that's really all that looking at a time series graph of a meditation session is good for, is to say, okay, I recognize that this was my experience and I'll learn from it. But I think we made a decision early on that we wanted to, that people seem to really like the idea of a score. Like, they liked a step count from a Fitbit, or they liked, they treated it like a game. So we created a scoring system for this, and people started to keep score and really focus on improving their score. And that, I think, is that attracted some criticism from the meditation community, because they get quite concerned that you're focusing on the wrong things. If you're competitively meditating, or if you're thinking about what your score was in Muse, you might be misprioritizing some aspects of mindfulness. I don't think that's wrong. I think that I've tried to encourage people who really get hung up on the scores in Muse to just try and focus on improving their own experiences, and like reflecting on what that means. And I think we learned a valuable lesson, which is you have to be very careful in the design of a technology for mindfulness or mental health, because you can easily get into incentivizing the wrong kind of behavior. That's true for, if you look at how Facebook and Instagram were optimized for, I would say almost against mental health to get people hooked and like seeking reward. And now they're moving away from that and they're trying to get people off the constant repetitive stereotyped behavior. You have to really be careful when you're designing technology that you do the right thing for people's mental health.
Mm-hmm. And this focus on neuroscience, like, did it come out early when you were growing up? Did you always were you always curious about the human mind?
I mean, I was always, we were very lucky in Northern Ontario that there's a really good science center that we all got to go to as kids in elementary school, Science North. And so that was always there from the early days. I grew up way out in the forest, so I was really into bugs and things, and the natural world. And then I started to get migraines when I was about 11 or 12 years old, and that became pretty fascinating because when you're first being diagnosed and you have these sudden acute symptoms, they're not sure whether it's a brain tumor. So like you're in all kinds of scanners and things, and you're asking questions of the technicians, and it's pretty interesting. Like, my parents were terrified, and I was just fascinated by these machines. So that turned into a sort of, I started out in physics at McMaster and studied medical and health physics, which is sort of applied brain imaging in a lot of respects, or applied imaging and related things about radiation dosimetry and radiotherapy. And from there, that manifested into a realization that the technical aspects of the imaging technologies were really, really cool. But ultimately, I think what motivated me was sort of the answers to questions about what the brain's actually doing and how it works. So that's where I pursued graduate school. And I was very fortunate to have a really exceptional mentor, a guy named Larry Roberts, who passed away recently, who was a really, really well-rounded experimental psychologist, neuroscientist, teacher, who had developed an interest in a fascinating phenomenon of phantom sensation, so tinnitus and phantom limb pain. And he became the world's expert on that late in his career. So he's sort of had two phases of his career. And that was fascinating in itself, to see somebody who shifted their research program, when they were 50 years old, 50 or 60 years old, into a totally new direction and became a world expert. And so that manifested into, getting into the animal physiology, where I did my PhD in Aix-Marseille at the National Scientific Research Center in France, and getting pretty deep into the cortical and brain physiology of how these disorders develop, and what can we do about them? What are the treatment options, and how do we design better treatments? Then some cool opportunities presented themselves to get involved in computational neuroscience and in scientific communication, and I leaped at the chance and ended up running Frontiers in Neuroscience, which is, I think, the biggest open access journal in the field still in neuroscience. And from there, because that was kind of a cool startup, it was a startup among publishers, I got the bug for startups and tech startups. Went on to, from some of the problems that I identified when I was working in the publishing industry and the opportunities for innovation, that led me to going to work with a company called Sciencescape, which later became Meta and is now Chan-Zuckerburg Meta. And solving some really cool problems about just information processing and sharing in the scientific literature, and how we share, how we discover information. And then after a little more than a year there, a friend of mine approached me about Interaxon and asked what I thought. And so I was introduced, and we just hit it off. And I came to, it was just sort of one of those serendipitous things where you really like the people in the place, and it seems like a very interesting problem, and the fit was right. So I joined Interaxon and rose to become the chief. I started as a postdoc here, and I ended up becoming the chief scientist. And because my PhD had been supported by a cochlear implant manufacturer, I had some background in medical regulatory affairs. So I ended up, taking on some of the regulatory responsibility for the company as well, and figuring out, navigating the regulatory paths in Canada and the United States and Europe, and learning all about, how to get a device through these kind of challenging different scenarios of different regulatory regimes and what you were allowed to use it for and what you weren't allowed to use it for and what claims you were allowed to make. And that got pretty interesting. So we've now launched, I think, 4 or 5 versions of Muse. I think we'll be on the 5th one this fall. Each one has been better than the last and has been, we've contributed a lot to the design through the data science and the research that we've done in improving this and in expanding its utility. So it's something I think the team, I'm really proud to have been a part of this team and to continue to be a part of it and to see how much, how well it's doing now and growing into, I think we're the largest, we're certainly the biggest EEG by volume of EEGs sold ever. Mm-hmm. We probably sell more EEG systems than all other manufacturers in the world combined because we sell a very low-cost system and because it's very popular as far as EEG goes.
How many are out there right now? How many have you sold?
Hundreds of thousands.
Okay.
Yeah.
Wow. And when you talked about the regulatory affairs, that was my initial curiosity too. When I saw your title, I was thinking, So I get that you're a chief scientist because you're a neuroscientist. I get that. And then when it said regulatory affairs, I was very curious on what has been for you the interesting thing about the regulatory affair part. The most interesting thing.
Typically when you're when you're working with something like EEG, there's a tendency for people to think of it as a medical device because most EEGs in history have been medical devices. Mm-hmm. And now that this technology, because of the advent of mobile phones and tablets, is moving outside of the laboratory, and the components from cell phone supply chains can be used for as an EEG amplifier, and you can make very low cost EEGs like Muse. You can make very low cost neurotechnology and wearable tech. These things are getting pulled in directions and into places that they have not historically been, never really been before. So there's one aspect of, what do we call this and what do we say about it, given that it's historically a medical device? And there are regulations in the medical device rules about what EEG is and what it can be used for. So you have to be very careful about what you're saying, and you have to be aware, and you have to teach your marketing team too. And so that's been one of the fun things is, as a scientist, you really want your claims to be veridical. You want to say things that are true, and you don't want to say more than that. And marketing has a fundamentally different tension. They need to say things to get attention and to get mind share and traction. And so they're always going to push as hard as they can. So learning to navigate that tightrope and to work with the marketing team to educate them has been a really interesting challenge. Another really interesting aspect of this is that because we're not the only ones doing this kind of innovation, the big tech companies are doing it, not just neurotech, but wearable tech and mobile health and digital health broadly. The regulators, especially in the US, are really innovating a lot. So they're creating, rather than sort of reacting to the technology coming along, they're creating sandboxes that say look, here are the things you're allowed to do. Go out and experiment and show us real world evidence. We show us that the devices are low risk, and then if we can confidently believe you that they're low risk based on the evidence you share with us, then go and experiment in the real world. So the Apple Watch is a really great example of this. They have an atrial fibrillation thing that's based on data science so they can tell you when you need to go to the hospital and get checked out.
Oh wow, I had no idea.
Yeah, and they do that with the photoplethysmograph. So it's a way of detecting irregular heartbeat that doesn't rely on ECG, and it's pretty accurate. And so it's a triage mechanism, right? It's there's 2/3 of the ones that they sent to hospital actually had irregular heartbeats, atrial fibrillation. Wow. So they did a study on 400,000 people with Stanford, and they found this incredible result. So that was pretty cool. And now that's a feature that you can roll out on Apple Watches. If somebody has a risk of irregular heartbeat and they have an Apple Watch, that's one more tool in the toolbox to help them live a healthier life.
Mm-hmm. And on this kind of career path of yours, you said you started catching the startup bug when you joined Frontiers in Neuroscience.
Yeah.
And so then before that, was the goal to be a scientist?
No, I don't think I was quite so organized as that. It was just more curiosity.
Okay,
so
it was
this is hard and interesting, so I'm just going to keep doing this.
Huh.
Yeah.
So then
it was I never optimized for income or a career development, because the last thing you want to do if you're interested in making money is become a scientist. If you go to grad school, you're rolling the dice on like where you go in your career. You can go into tech and you can go into other places. You can go and become a patent lawyer or whatever if you're in like a science or engineering field, or you can go into those fields, and that means that's always a trade-off, right? Because if you want to go to the academic route, then you have to take the jobs where they come. You have to move around a lot, and it's an unstable life for quite some time. If you want to go into tech, it's high risk, but it's also can be very rewarding. So there are so many options available to scientists and engineers now. And the really cool thing for me has been to see in the last 5 years, like this explosion of neurotech opportunities for neuroscientists and for people coming out of grad school, even undergrads and masters. You do neuroscience undergraduate degrees didn't exist when I was an undergrad. Like they were psychology, experimental psychology, but they've only sort of popped up in the last 15 years. And now they're everywhere. Every school has one, and it's hugely popular. And we're graduating all these kids into, what are you going to do with a neuroscience degree? Well, a lot of stuff, so that's useful. But now there are actual jobs in like tech for neuroscientists, whether it's UX research or human factors or biosignal or medical device or like consumer neurotech or sort of high tech neurotech, the frontier stuff like Neuralink or Kernel. And so if you go on the NeuroTech X, which is the big community of enthusiasts and hackers, if you go on their jobs board, there are tons of jobs for neuroscientists out there in the private sector. And that's a totally new thing. That's like just in the last few years. It's been a remarkable change that now, I think in part because people are more aware of the importance of brain health, and they want devices and they want cool, like new ways of interfacing with games and with technology. And so there's demand and there's interest and there's opportunity as a result.
But when you were actually going through it, like, so you finished your graduate, so you did your master's in neuroscience, and then when you went to do your PhD, like it was covered by, I think it was Opticon.
Oticon, yeah. Neuralink is
Medical,
actually, I think it was the company, and they were acquired by Oticon Medical.
Oh, okay.
Yeah.
And so, yeah, like you had a sponsored PhD, but would you have done a PhD? Was it planned to even do a PhD if it wasn't sponsored?
Yeah, well, I mean, yeah, most science PhDs are financially supported by scholarships.
Okay.
But the best scholarships to have are either the really big like Canada graduate scholarships or the industry ones, because the industry ones pay a lot better, and you get access to a different world that the purely academic graduate students don't get to see. Like you're in the academy and you're seeing everything that they see, but you're also seeing the industry world and how it works, and you're making connections to people who can explain to you what it means to be a research engineer in industry. Yeah, I recommend to everyone who can, if you're interested in the brain, or if you're interested in kind of anything life sciences or anything, if you're going to go into a PhD and you can get a company to pay for it, do it. There are plenty of programs out there in Canada. There's MyTax and OCE. In France, there's CIFRE. I'm sure there are other ones in the US and UK where part of the scholarship is covered by the company, and part of the scholarship is covered by the either the university or like the funding agency from the country.
Oh, okay.
Yeah.
And so then how would you distinguish the difference between like neuroscience, psychology, and like human behavior? Are they different, or?
They were. They were. There was a pretty strong dichotomy between them. If you go back to the 50s and 60s, neuroscientists were people who were working on cells and like trying to understand the physiology of cells. And psychologists were people who were trying to understand the mental models and behaviors of people. And there were all kinds of different schools like psychoanalysis and behaviorism that went off in in radical directions a very long way before there was a sort of a self-correction within the fields. And I think since they've just been converging more and more. So there are people who will say crazy things like, you don't need to study behavior in order to study neuroscience, which is technically it's true. You can go in and just study cell types and say like, what's the morphology and what genes are expressed in this cell type. But ultimately, the brain is the nervous system is there to generate behavior. Like that's the purpose of the nervous system in a mammal is, or for that matter, in an invertebrate, is so that it moves around in its environment and adapts and like gets food and does the things that motivate it. So the nervous system is there to produce behaviors, and to perceive the world and react to it, and to plan and to take actions. So I think you want to know something about behavior. And you want to know something about psychology, because psychology is ultimately a successive approximation and like building better and better models of what causes people to be motivated in certain ways and why people do certain things and what patterns they get into that are healthy and unhealthy. Cognitive science and psychology and neuroscience are three sides of the same question. So, and not even necessarily distinct. I think in order to be well-rounded in a scientific field, whether you're in industry or the academy, you want to understand all the concepts, the basic concepts, and the sort of principles behind these.
And do you think that if for someone who's, let's say, already graduated, but they don't have a science background, but with this explosion of neuroscience and all these kind of neurotech opportunities, people start, like a person gets really interested in it. For them to get involved, do they have to go back and do like a graduate school? Or?
No, you don't have to do that anymore. No. We have lots of people in our company who have never been to graduate school and don't have a background in neuroscience, but know a lot of it now because they worked at Muse. So people who are database coders and developers, our data scientists were almost pure data scientists, and now they know a lot about brain stuff because we've been working together for years on understanding what these signals mean from a data science perspective and from a signal processing perspective. So they, you pick up a lot of stuff on the way. You can be a software engineer and kind of do almost anything you want, or a computer scientist, and you can go in any kind of direction, or electrical engineer. Those are great ways to get into neuroscience. Comp sci or electrical engineering are absolutely fantastic ways to get into neuroscience. Some of the best neuroscientists I've known in my life have been initially trained as electrical engineers.
And so then, among your peers as neuroscientists, what do most of your peers end up doing? Are they mostly in like academia, or would you say that?
No, I think I'm a little bit unusual in that because I've been in industry and I have this industry bent and I engage with other companies and their scientists. My peer group is probably more of a mix. Like if you talk to academic neuroscientists, they probably don't know very many industry neuroscientists. Which is a funny thing, because if you look at chemistry, like 80% of chemistry PhD grads go and work for chemical companies or like petroleum companies or things like that. And in academic neuroscience, it's been traditionally more like everybody stays in the academy, or they're no longer really doing neuroscience. They go out and do something else. Now that there's an industry, there's a neurotech industry, there's a neuropharma industry, and there's a lot of interest in neuroscience from things like policymakers. You can really end up getting there are a lot of different, I think, opportunities to engage with these things from different perspectives. So my perspective is if it's biased toward I think almost more overtly engaging more with industry neuroscientists and trying to push more graduate students to think about careers in industry. Because I think the academy, if you're in grad school, your professor most likely only really knows. The younger ones are a little better, but the old ones mostly just know about what an academic career is. So they're not really prepared to set someone up for, how to transition into industry. That's tricky if you don't have a mentor who can help you. So where I help out and where I get involved is kind of in advising and counseling, and maybe even encouraging people to think about careers in industry, because they have this intense pressure to think about a normal career as staying inside the university, which is not normal for any other field, right? Like chemistry or any kind of engineering. If you go and do a mechanical engineering graduate degree, you're still most likely going to go out and work in industry for like a manufacturing company or something like that.
And for you, when you were in your own journey, like did you have a period of being misunderstood by the industry because you were like different from the others?
No. I think I've always sort of tried to chart my own path, and initially when you're leaving the academic lifestyle, your friends are all kind of wondering like, is that something that people do? They they tend to think of it as like, oh, you're leaving, rather than like, no, I'm intentionally going over here. Like this has been my plan all along, is to get an industry job. I mean, it's I just find the pace of things and the practicality of the problems more engaging. I still like to do this discovery science. And I hang out in my friends' labs from time to time and ask a lot of questions, and like occasionally sit in and like patch a cell just for fun. We try to do some discovery science from the perspective of big data, because we have a bigger data set than anyone has ever had in EEG before. It's very sparse, but you can see things. We're seeing things in there that people haven't reported in EEG in the literature before, which is really exciting, because it suggests that we can answer questions that people have not been able to answer before, just through the sheer volume of data.
And when I think about what neuroscientists create, with research, it seems like, I'm definitely biased here, but it seems like from the outside that the final product is a giant white paper or some kind of research paper that kind of, I think puts all the research
because the way that for two reasons. One is that the way that you continue to operate your lab is you're measured based on your publication output and the number of students you graduate who come out of your lab and where they go. And so I sit on a couple of committees, evaluation committees that with mostly academic scientists for grants and things. And one of the criteria is, where have this person's students gone? Although, this person's a professor here and this person's a postdoc there. And my push is always like, how many people have they sent to industry? How many of their students are doing science outside of the academy? And that, I think, is a question that, they don't quite know how to ask or answer if you're an academic scientist. So that's my contribution, or one of my contributions to these kinds of evaluations. Mm-hmm. So you have to play that game of publishing papers and getting cited, publishing papers in high impact journals, just in order to get promoted and operate your lab. And then by the time you're finally free, and you're never really free, because you have to always think about the next grant. But by the time you finally got, you're a mid-career or senior scientist, and you could say, what, I'm not going to do that. That's the game, and that's the game you keep playing. So, there's nothing stopping people from, in a lot of fields, in data science and in big parts of neuroscience and neurotech, the trend is becoming, or especially AI. AI is a really good example of this. The trend is moving away from journal publications and to just preprints. You just put it up on a server and then people comment on it. It's a different form of peer review. And then publish your code and publish your data. And younger neuroscientists tend to do this. And I think that's a really good thing, because it produces much better science faster. You can still have all of the other layers of peer review and everything on top of that. But this is the open science movement, and just code sharing and version control, just posting all of our tools on GitHub is an incredibly powerful tool for accelerating science, because it gets us out of our little niche groups. People from places we would never have dreamed might be interested in our work can discover it.
And so when you first joined Interaxon, I think you joined on as the first neuroscientist into the company, right? And so when you joined on, what was the first question? Was it, how do we prove that meditation works with this device? Like what's the process? Really good question. Yeah, what's the process for going about solving this tough problem?
When I came into the company, I think they had in mind that I was going to come in and solve one problem for them, and I came in and solved different problems. So, there was the question that was on the minds of everyone when I arrived in Interaxon was, how do we prove that this device works as a meditation tool? And so there was some work underway, some collaborative work underway to try and achieve that. I took a step back and said, okay, well, there are questions out there. If you go and ask people like what they think of this tech, they don't even believe that it's a working EEG system. So let's try to establish that. So we set up a number of collaborations, and we opened things way up and said, here are all the tools you can use. And if you build an open source tool, we'll feature it on our website. And so people started doing that. And I started sending free muses, which we can't do anymore, but I started sending free muses to influential EEG neuroscientists and saying, we'd love to see what you can do with this. Let us know. Just publish your code and we'll share it. And so we got some really good results from that. So people were publishing open code. They made JavaScript connectors. They made lab streaming layer, which is quite a common protocol. They made a connector for that. There were groups of people who built, there were all kinds of hackathons that started using Muse. And then we discovered a problem there that participants in hackathons had no idea what to do with EEG neurodata. So we had to build, so that actually became a hackathon project in itself, was let's build a tool to educate hackathon participants about how to use these data streams. And that turned into a tool for high school education with Muse. So then it started to get into high school science classrooms and undergraduate science classrooms. So just by supporting this open ecosystem, I think we really effectively debugged the problem of like people not believing that this was a working EEG system. And then we started to ask questions like, okay, how do we understand, rather than trying to prove that something works, how do we understand whether it works and how effective it is? And not just like, does it work at all, but is it, if you're comparing this thing to, if it's a tool to learn how to meditate, let's compare it to an app. Let's see, what people use. Part of that is effectiveness, but part of it is also engagement. So what do people do? Do they like to put a thing on their head and listen to weather sounds, or sit on the beach and try to hear birds chirping and things like that? Or do they like to listen to instructions on their headphones from an app that doesn't give them adaptive feedback and direct feedback on their brain? And what are the differences? It's not just a question of one being better than the other. Is one better for one type of person than the other? Is this a niche? Is this a product that fits some niches better than others? Guys seem to like it more than women, a little bit. There's a slight skew in the customer demographic. There's more guys than girls but then that turns out that's true of all early wearable technologies. There's a gender bias. Tech early adopters tend to be men. Not always, not exclusively, but there's going to be a skew. So, we don't have answers to all of those questions yet, but we have some good papers out that have come out with institutions like Massachusetts General Hospital and University of Toronto and the Mayo Clinic and a few others that have shown that, this actually, Muse does produce comparable outcomes to a mindfulness course, and it produces those in the same time frame or shorter, like 4 weeks. You get a comparable outcome in terms of reduction of stress and increase in resilience, and so that was nice to establish. And now I think we're on to really pushing the envelope on how much more can we get out of this system, and what are the modifications we have to make to build this into something really great that can do not just meditation but other brain health applications. How can we measure brain health? Can we detect brain disease? Those are the kinds of questions we're asking.
And so when you're actually building out this process, does it start with some kind of hypothesis where you say, okay, well, if we put this code base in and we see this imaging, we're going to assume that this means reduced anxiety, and then
you have to go and get a population of those people to put your device on. So you have some idea where to look because the scientific literature gives you clues as to that.
Right.
But you have to go and then prove out that you can detect it with your device because you have a much sparser EEG system. So it's, do we have enough resolution in this thing to detect what these people say that they can detect with a high density EEG system? So that's part of the challenge is setting up research collaborations with people who work with populations of people with, say, anxiety or ADHD or dementia. And so we set up collaborations with them and we do projects together, and then they collect data and they do the experimentation, and we help them with the analysis, and then we might publish a paper together, or they might just publish it.
Oh, okay.
Yeah.
Do you always have to publish a paper? Is that the kind of final thing that
they always
required?
do?
Okay.
Right? The academic scientists always do. If you're trying to get a device approved for clinical use or a medical device approved by the FDA, you have to send the data to the FDA. You have to share it with them. And you have to involve them in the study design. But that's a more involved thing. It's a very highly rigorous, but also very highly controlled process. So bigger sample sizes than academic research experiments. Because you're trying to ask a different question, right? It's like, does this work for everybody? Can this be endorsed as a diagnosis or a treatment, or a triage system? versus like what is the effect on the brain of these different things,
Right.
which is more of a fundamental question, which is like what the neuroscience academic neuroscience labs will do.
And like going on this journey of, going down the academic path and then going to the startup world and going into industry, was there like a particular moment that you can like think back on that you feel made a very impactful inflection point in the route you decide to take?
Yeah, I would say it's been having really exceptional and generous mentors.
When you were in the PhD program?
Throughout my life. So, undergrad, I had some great profs who were really good and really encouraging. In grad school, I had some excellent advisors and some very, very supportive people who were not necessarily even on my committee, but who, just were just genuine and kind and gave me their time and gave good advice and encouraged. That's really important. It's for somebody to say, I think you can make it if you try. So
were the advice like more skewed towards like, you should try it in industry, you should go out and do this?
Yeah, I had some advisors saying, I don't know if you're going to enjoy the academy as much as maybe some people do. So you should, even in early grad school, it's like, you should think about other stuff because you seem a little impatient for this. So
good feedback.
Yeah. Yeah. I mean, pulling like 18-hour days in the lab because you want to get your experiments done faster is, that's, so some people that might be seen as maybe a little pathological, and they're like, you're not going to be able to sustain yourself if you do this. Maybe you should go and work for a tech startup where that's the kind of a thing that people do. It's like sleeping under their desks. I don't do that anymore, but that's learning work-life balance, which is another tricky thing for scientists and grad students to learn as well.
Well, it seems like you might be going down even.
I am, yeah.
More
this is exciting.
Path.
So I'm at the end of the week. Actually, this is my last week at Muse.
Oh wow!
And I'm leaving with two more other colleagues to start a new neurotech company that's going to do a different imaging modality, different application. But one of the things we're excited about is everything that we learned about how consumers interact with neurotech and what it takes to build a business from the ground up and scale things and really make them happen. You have to kind of do a little bit of everything in a startup, and so it's getting back to basics and learning new skills. So I'm going back to like, how do you run a business 101 and like starting from scratch on setting up a scientific advisory board and a research program and an R&D program and doing the coding myself for the analysis instead of like working with the team and like mostly delegating. So that's fun. And there are all kinds of things that you just can't anticipate when you do a new startup that force you to learn. So that's, today I was, when I woke up before I came into the office, I was learning about web Bluetooth because I needed to know it for the new startup. So it's a fascinating thing, right? It's another skill you have. So you can pick up a new skill every day if you're doing a tech startup. That's one of the most fun things about it.
Oh yeah, like I had no idea how to edit audio, and
right.
Now I know how to do all this stuff.
Yeah, and that's fun too.
Yeah. And but what was that decision process like when you're actually making the decision to leave? Like you have this great thing going on in Interaxon, and new products coming. And...
No, it was. I think it's that same thing as about that kind of impatience. It's like, well, I've been at Interaxon for 4 years now, and I'm pretty proud of what we've achieved here. There's lots more to do, but maybe it's time for something different. And the opportunity showed up at the right time when. I guess I was just ready for it. It's like, yeah, let's go start from scratch and see if we can make this totally new thing work in a way that nobody's ever used it before, and build a new technology that could change a lot of people's lives. That's kind of the fun part. That's what's exciting about it. So it's me and my two colleagues. I spent the weekend, rearranging the furniture in my condo so that we have 3 desks now. In a 1-bedroom condo, and one of them is the kitchen island. So it's going to be a lot of fun, and it's really exciting to be a part of. So,
and so, like, did you not have any fear with this kind of decision?
No, I mean maybe a little bit. It's not. the easiest thing in the world to just decide to take no salary anymore.
Right. Yeah.
Especially when you're not rich.
Oh yeah, I've been feeling it for the last 18 months. It's horrible.
It's like, I think if you were rich, you would just whatever. But you have some savings, and it's taken a lot of time to build them up, and you're thinking, okay, well, I don't want to dip into those, so I'm just going to live extremely cheaply for, there's going to be no going out for maybe once every month, go out for a beer with a friend and cooking your lunches. And so it's like Spartan mode, that's one of the things, the underappreciated features of graduate school is you learn how to live well without any money and enjoy life without any money. So it's not that hard to go back to. I think that's one of the things that's underappreciated about grad school or graduate students moving into industry is you're set up to be successful at a tech startup because you know how to debug problems yourself, and you know how to find solutions where none exist, and you know how to live on like rice and crackers when you need to. Rice and crackers and 6 hours or 4 hours of sleep.
Those are valuable skills to have, definitely.
Yeah.
Graeme, I think we're kind of running onto the end of our timeline here, but
it's been a lot of fun talking to you. I really appreciate your including me in the podcast. This is great. Yeah,
and honestly, there's so many more questions I want to ask, but I'll kind of try to keep it to maybe like one last one, and that it's if your 20-year-old self were to look at what you're doing right now, so I guess that'd be the Graeme in third year McMaster, still in physics. What do you think that Graeme's emotional reaction would be to where you're at?
I think it would be. That's a good question. So third year Graeme decided he wanted to be a fighter pilot and went down to the enlistment center and actually got through and got selected to join the Canadian Forces as a pilot. And then they said you have to drop out of McMaster and go to RMC for your last year of university. And I was like, but I'm in a very good school. I said, sorry. So I was like, oh, okay, well. So yeah, I was in a very different headspace then. Decided to finish my degree at Mac, and I'm eternally grateful that I did. But I still would have liked to have been a pilot. I've been all over the world. I got to live in the south of France and do my PhD at between NeuroTech, which was in like Sophia Antipolis, one of the most beautiful places in the world, and Marseille, which is one of the most interesting places in the world. And then I got to live in Switzerland to do work with Henry Markham at the Human Brain Project, and run Frontiers in Neuroscience, and sort of see the world and travel all over the place as a scientist working in industry. And since I've been here in Interaxon, I've been everywhere. At the OECD meetings in China, talking about neurotechnology. Developed an interest in policy and become a fellow at the University of Toronto, the Monk School of Public Policy, working on, among other things, innovation policy, like how does Canada and how do countries in general build up their tech sectors and increase quality of life for everyone through tech policy, and what do we do about neurotechnology? So I've sort of flown all over the world and seen all kinds of great places, and my 20-year-old self should not be complaining about this. If you had a chance to look at it, this has been a really fun ride so far.
Awesome, man! I can't believe I didn't learn that you were a pilot sooner. There's a lot of questions there, or you wanted to be a pilot.
No, I was a pilot. And I let my license lapse, so I'm gonna have to go and get recertified.
Wow. Yeah. Damn, you've definitely lived a very fascinating life, Graeme, and I really appreciate you just sharing like a piece of it with myself and my audience on the podcast.
Thank you very much. It's been my pleasure.
All right. Thanks for coming on the podcast. Take care. All right. Thank you for listening to the podcast. I hope the story was inspiring to you. Hopefully it also helped you expand your perspectives. Hopefully it also made you question the default path that you might have been going on, or the default beliefs you might have had. And maybe now it'll make you even think about doing something about it, doing something different, maybe challenging yourself, being courageous. Who knows? But regardless, I'm really happy that you took some time out of your day to listen to this fantastic story with my guest. And if you would like to somehow, in some way,
contribute and help support the podcast, and maybe even just be part of the community that I'm trying to build with the greater OMD Ventures platform. Really think about being a stakeholder in the platform. And the quick way to do that is to go to my website, oldmandan.com, and go to the stakeholders page. I believe it's oldmandan.com/stakeholder. And the link is also down below. And that's how you can figure out how you can subscribe, follow to get more updates on the free content, but at the same time also donate by actually just buying me a coffee. That's just how I put it. And you can buy me a coffee a month, coffee a week, or coffee every day of the year. And think about it as the way that, if you wanted to chat with me, you might just bring me out for coffee and buy me a coffee. Or if you wanted to bring one of my guests out to chat, you might buy them a coffee. So just think of it as I'm the service that's doing that for you, so you can just pay me in coffees. Don't worry, everything will still be free. It would just really help if you would like to show your support this way, so that I can use the coffee money to buy myself actual coffees, and also to buy my guests actual coffees, and use the leftover money to actually grow the platform, as well as even keep it operationally alive as well, because all this isn't really free, and it does take a lot of time to build it as well as operate it and hopefully grow it further. So your support would be amazing if you would like to contribute. And so just check out the website, go to the stakeholders page, and read the different kind of benefits you might even get as a stakeholder. All right, thank you.